So you have a bad case of tennis elbow and you're wondering, what can I do next? In this video, I'm going to take you step by step through my recommendations, but also discuss with you an exciting new injection I have available that is actually really effective at treating tennis elbow. For those who don't know me, my name is Dr. Sonam and I'm an interventional sport medicine doctor located up in Canada. Now, if you find any of this content helpful, I would really appreciate it if you could like, subscribe, share this content so it can reach a wider audience. For now, let's get back to talking about my recommendations for tennis elbow treatment and that new injection I have available to me. What is tennis elbow? So tennis elbow also stands for lateral epicondylitis, is pain and inflammation at the lateral epicondyle of the elbow, which is this guy here, so the outside of your elbow. And what it is, it's actually a pain at the tendon insertion of the extensor tendons and the supinators. So when I explain this to people, I say, all of these muscles that extend your fingers and turn your palm out, for example, will all attach at this one origin point at a single common tendon. And tendons can be finicky. So when the strength of a tendon is equal to the load placed on the tendon, there's no pain. When the strength of the tendon is higher than the load placed on the tendon, there's no pain. When the strength of the tendon is less than the load put on the tendon, there's pain. And this is why people can develop pain on the outside of their elbow if they do a lot of chronic repetitive tasks, if they're, for example, renovating or painting, for example, all over one weekend and then develop elbow pain afterwards, if they're new parents. Basically, when the load on that tendon becomes greater than the strength of that tendon, that's when you develop that chronic irritating tendon pain. And that's pain, inflammation, and irritation at this side, resulting in tennis elbow. Now, it can be quite finicky and quite annoying for a lot of individuals, and I have a series of treatment recommendations that I want to go through, but then I want to talk to you about a new injection option that I'm actually using with really good success in my clinical practice. So number one, I recommend people decrease load. This happened because there was an overload of the tissues, so while it is healing, you must decrease load, so stop doing the thing that's irritating it. Number two, eccentric training of the tendon. So in tennis elbow, it occurs essentially because the tendon is not strong. And one of the ways to strengthen a tendon is to eccentrically load the tendon. So that means that you want to focus on things where you are resisting a load while you're lengthening a muscle. So think about, instead of doing a pull-up like this, you want to do a negative pull-up where you're lowering yourself down against the resistance of yourself. So two exercises that I give my patients are wrist drops. So one is I ask them to hold a small weight, whether it's a can or a 1 or 2 pound weight, put their hand on a table, raise it all the way up, but then really lower it slowly, and then raise it up, lower it slowly. And then I want them to flip and also do the other side to protect the inside of their elbow. This is really important because this helps build long-term tendon strength over time. Number three, work up the chain on shoulder stability. A lot of the times people develop tennis elbow pain because their shoulders aren't strong, so that their elbows have to do more of the work. So when you see a physiotherapist, for example, they will look all the way up the chain and work not only on those eccentric exercises, but rotator cuff, scapular stability exercises, and other shoulder strengthening exercises as well. Number four, pain control. So during a flare-up of tennis elbow, pain can be really bad. So you can definitely take your oral pain medications, topical pain medications, just check in with your doctor to make sure that these medications are right for you, but they're available to you when you have a bad flare-up. Number five, a tennis elbow brace. So there are tennis elbow and counterforce braces that you can use to help change where the force on the elbow is placed. So these braces typically are placed lower than the area of pain, and then they create a new force vector where all the force is distributed on. So basically, this area here doesn't have any irritation or force being generated. All the force of your muscles ends here. And I really encourage people to use these braces when they're doing a lot of physical activity during kind of a bad chronic tennis elbow flare-up. Number six, shockwave therapy. So shockwave therapy is a really great non-invasive treatment that can be quite effective for tendon issues. And what it is it's a loud shockwave machine that creates a lot of vibrational force that creates micro trauma to the area that can help stimulate healing of it. So in people who are looking for a non-invasive option, it is a recommendation that I will make, and usually it's done by physiotherapists, chiropractors, other allied healthcare professionals. Number seven, allied healthcare professionals. So I talked a little bit about some of the things that these allied healthcare professionals will do, but acupuncturists, chiropractors, physiotherapists are all valuable to see during this time because they can help you optimize the non-invasive treatment options for a tennis elbow. And the vast majority of people do respond really well to these options. Number eight, so before I talk about injection therapy, last line option for tennis elbows that are not getting better, can be a surgical release. But I almost never see this because the vast majority of my patients, we can get the tennis elbow to settle down with all the recommendations I'm talking about in this video. But just so you know, we do have this option in cases that are refractory or not getting better to treatment. Number 9, and the one I want to talk to you a little bit more in depth, are injection options. So this is where a lot of people will be referred to me to discuss their injection options. There are 3 main options that we can use in tennis elbow. One is cortisone, which is an anti-inflammatory medication that I almost never want to put in an elbow. And the reason why is there's a lot of research that shows that cortisone can actually, well, it is really good at taking away the pain. It stimulates tendon degradation, tendon weakening, and a year out, you're probably worse off functionally than you were beforehand. So in my younger patients with tennis elbow, I really try to talk them out of getting a cortisone injection because it actually can just weaken the tendon and the tissue long term. The second injection option that I have available to me, and the previous gold standard, was PRP, which stands for platelet-rich plasma. And so I take your blood, I spin it down, and I'm needling your blood product back with growth factors into the area of concern or irritation. Now, this causes a considerable amount of pain and can take you out of a lot of activity for a good few weeks before you get back to physical activity, and then a good month or so before you're getting back to your full physical activity and your full lifting activities. This is also, unfortunately, a very painful procedure. So while my PRP injections are very effective for chronic tennis elbows that are not getting better, they hurt and they're not comfortable to do. And I oftentimes have to give people prescription pain medication for a few days afterwards. Not only do they hurt, they unfortunately take people out of their activities. So while it's amazing, there are some downsides to this injection. So my last injection option, which has now become my first line injection option for people who are looking for injection treatment for their tennis elbows, is called SportVis. And this is a new injection that I've been using up in Canada for the last 1 to 2 years. And it is a soft tissue biocompatible hyaluronic acid. Basically, it's hyaluronic acid for tissues, and this is a brand new thing that we've had access to and available to us. Prior to this, I was only able to use hyaluronic acid in joints because they were only created and developed for joints. Now we have the ability in a formulation that we can use it in soft tissue and in tendons. And the way that this injection works is it's hyaluronic acid that's synthetically made, and it's 2 injections that I apply kind of over the tendon 1 week apart. And how I describe it is it's like a Band-Aid that I'm producing over the tendon that will help decrease pain by blocking pain receptors, increase and stimulate healing by bringing blood flow to the area, stimulating healthy collagen formation, which is really the cornerstone of a proper tendon, and overall teaching your body to heal that area. The best things about it are the injection itself is not very painful because I'm not in your tendon, I'm above your tendon. There's 0 downtime to it, so people can go home and play tennis that day. And the injection results can be seen about 1 month after the 2 injection series, so a lot sooner than PRP. I've had some amazing results with this injection, and I've been using it a lot, specifically in tennis elbow, but now expanding the use elsewhere. But it's definitely changed the game on how we treat a lot of soft tissue injuries, because prior to that, we only had cortisone and PRP. But I like that this is bridging the gap in that there's not much pain associated with it, and the results are much faster and quicker, but it still works on a regenerative capacity. So I hope you found my step-by-step instructions on how to treat a tennis elbow helpful. If you have any questions or comments, leave them down below. If you want to hear a little bit more about how I'm using this new injection, let me know, and I'd be happy to answer your questions. For now, that's all.